Okay. Hello. Madung Madungog ako.
Yes, sir.
Okay, let's start. This is long quiz 4. This is all about non-fermentative bacilli, uh, anaerobic bacteria, mycobacterium, and the remaining of the modules. Okay. So, first question, which tests are most appropriate to differentiate Pseudomonas aeruginosa and Pseudomonas butida? So the correct answer is mannitol fermentation and nitrite reduction. So for this one, both organisms, Pseudomonas aeruginosa and Butida, are oxidase positive. Both of them are motile. Both of them produce pyoverdine, ONPG positive, but um, they differ on mannitol fermentation, nitrite reduction, as well growth in 42 degrees centigrade. So for mannitol fermentation, nitrate reduction, and growth on 42 degrees Celsius, Pseudomonas aeruginosa is positive for those tests, while Pseudomonas butida, negative yun na siya. So therefore, Pseudomonas butida will not grow at 42 degrees Celsius. It does not reduce nitrate to nitrite, as well as it does not ferment mannitol. Second question. Specimen from 21-year-old male burn patient was cultured after debridement and following results were obtained. So oxidase negative, catalase positive, arginine hydrolase positive, glucose oxidation positive, penicillin resistant, sensitive, colistin sensitive, aminoglycoside sensitive. So the correct answer for this one is Pseudomonas aeruginosa. Why Pseudomonas aeruginosa? So first thing, if you view the history class, burn patient. So Pseudomonas aeruginosa is the most common significant organism that is isolated among burn wound infections. So it can, since Pseudomonas aeruginosa is a opportunistic infection, so pwede siya makuha from bisag asa, whether it's from the environment or from the water or from water sources or pwede sa mga environment during the procedures nga ginabuhat. So, Acinetobacter is not also the answer, di ba? Acetobacter baumannii and Luofi nasa choices because Acetobacter species are oxidase negative, while Moraxella naman is not the answer, or rule out si Moraxella because Moraxella is highly susceptible to penicillin. Diba? Ang choice is penicillin resistant. So, that is why ang mahubilin is your Pseudomonas aeruginosa. How often should catalase, oxidase, and coagulase reagents are tested? So the correct answer for this one is A and C. So one each day of use and when the vial is first opened. So you perform first catalase, oxidase, and coagulase um, reagent controlled test before doing your actual um, testing. So before mo mag-start sa shift, so inyo na siyang quality control and before also or after mag-open sa mga first vial. This is common questions class sa board exam under laboratory management. So, how many tubes of media is or are inoculated and what are the precautions should be taken? So, if you notice, nagduha ra gyud na sila class. So, 1 and 3 tubes automatically wala na siya. Roll out na ni si 1 and 3. So, ang mabilin naman lang dira is 2 tubes. So, the correct answer for this one is 2 tubes, but 1 covered with oil, so the air is excluded. So if you notice, ang isa na niya, na yun ay covered ko na oil. So that ma-detect po si anaerobic organism. Next, what's that PRAS mean? PRAS mean is pre-reduced, anaerobically sterilized. So these are common tubes for anaerobic cultures, PRAS na mga tubes. So again, it's pre-reduced, anaerobically sterilized tubes. Which biochemical tests are needed to differentiate Bocholderia from Stenotrophomonas maltophilia? So the correct answer is pigment on BOP and oxidase tests. So wait lang. So for this one, your pigment for Pseudomonas, for Bocholderia cepacia on blood agar plate, usually that's green-yellow, while your Stenotrophomonas maltophilia, that is lavender green. Then, oxidase positive naman si Bocholderia cepacia, while oxidase negative naman si Stenotrophomonas maltophilia. Sa denase naman class, denase negative si Bocholderia cepacia, while denase positive si Stenotrophomonas maltophilia. But both of them are motil, so excluded ni siya. Kaya na may motility nga testing. They are glucose, maltose, and lactose fermenters. Okay, they do not give pigment on McConkey, and both of them are still motil. So the pigment is only shown on blood agar plates. Alkalogenes fecalis is distinguished from Bordetella bronchoseptica with which test? That is urease test. Because Alkalogenes and Bordetella belong to the same family. Bronchoseptica class is urease positive, while your Alkalogenes is urease negative. Both of the organisms class are oxidase positive and grows well on McConkey agar. So, in order to distinguish the two, although they belong to the same family, so mag-perform ka og urease test. So, positive result is katong color pink. Flavobacterium species are usually distinguished from Acinetobacter species by which of the following tests? So they have there oxidase and growth on McConkey agar. Because your Flavobacterium and Acinetobacter species, usually they produce yellow pigment on blood agar plate, and they are non-motil. So Acinetobacter species are oxidase negative, while your Flavobacterium are oxidase positive. Both of them grows well on do not grow on McConkey agar. So the correct answer here is oxidase and growth on MAC. Because again, oxidase positive si Flavobacterium, oxidase negative naman si Acinetobacter. While mo grow sa MAC si Acinetobacter, si Flavobacterium naman dili siya mo grow sa MAC. Citramide agar. Citramide agar is commonly used for Pseudomonas aeruginosa to detect the pigments. So, for pigment, para maklaro nimo ang pigment sa iya, citramide agar ang gamiton. Yellow pigment producing organism that is oxidase positive, non-motil, and does not grow on McConkey agar, that is your Cryptobacterium meningocysticum. The old name of Cryptobacterium meningocysticum class is Elizabeth Kengea meningocysticum, but this is the new name now, Cryptobacterium meningocysticum. So iyahang characteristics is the yellow pigment yellow pigment coloration, yellow pigment colored sa blood agar plate, and it does not grow on makonki agar. Next, a culture of an abscess produces yellow orange tan colonies with the following biochemical results. So this is a characteristics of Shewanella putrescens. Your Shewanella putrescens class produce orange to tan colonies, and it is also H2S on both TSI and um, KIA. So, siya. Your Acinetobacter, Pseudomonas, and Flavobacterium does not produce pigments. Of course, on dili nimo siya maklaro ang pigment sa blood agar plates. As it Pseudomonas pigments, of course, is mga yellow, green to bluish green. Which Pseudomonas species is associated with virulence factor, exotoxin A, antimicrobial resistance, and production of alginate? So this is common to Pseudomonas aeruginosa. That is why there are some Pseudomonas aeruginosa class that is mucoid because of the overproduction of the alginate, which is the component of the capsule by Pseudomonas. So kung overproduction na siya, usually the organisms in vivo will form biofilm. This one, Pseudomonas species on BOP described to have raised, rough, wrinkled colonies with regular margin. This one is a general characteristics of your Pseudomonas tutziri. Basta mga wrinkled colonies class Pseudomonas tutziri na siya. Ano siya na answer? The causative agent of your amyloidosis or Whitmer's disease, that is Pseudomallei. Although its amyloidosis class do not be deceived, but the causative agent is your Pseudomallei. Malay is different because Malay, Burkholderia, Malay is for your glanders disease. Again, amyloidosis, Pseudomallei, glanders disease, Malay. So, glanders disease class is is an infection that is rarely transmitted to human. So, usually sa mga donkeys or sa mga horses na siya. Your Pseudomonas malay is not part of human indigenous microflora. So, this can be transmitted when there is mga abrasions or mga skin cuts. While your Pseudomallei or Brocaderia pseudomallei produces infections that can cause abscess class of your liver, spleen, or lungs. So, the organisms class may stay longer sa environment for several years until such time pwede po siya maka-transfer sa another human infection. That is why infectious control class, if maka-isolate kag Pseudomallei na organism, i-report ginani mo siya. May possible pwede man siya maka-cause of infection sa other healthcare workers. Next, which of the following tests may be used to differentiate Cardiobacterium hominis from Actinobacillus species? So the correct answer is indole testing. Next, Kingella kengiae can be best differentiated from Eikenella corridens using what medium? This is sheep's blood. Because Eikenella corridens class, usually you will see mga pitting of the agar. While sa Kengela Kenge, walay mga pitting of the culture medium. Kengela Kenge is usually associated with what infection? So this is endocarditis type of infection. Kengela Kenge class is an opportunistic infection, but when it comes to um, because these are normal part of the normal flora actually of your upper respiratory tract as well as your urogenital tract. But when they are disturbed class or when they can cause, they have opportunity to cause infections, they can go to the bloodstream and then affect now the um, several organs like heart. So, mo nang maabot makakos yung endocarditis usually. So, specimen of choice for Kengela Kenge isolation is of course since bloodstream infection man siya, so you can do blood culture. Culture obtains from dog bite wounds. So you have there already a clue nga dog bite wounds siya which produce yellow tan colonies. So that is Capnocytophaga. So mga dog bite wounds, Capnocytophaga class, particularly your Canimar Canimarsus organism or species, or associated infection resulting from dog bites. Oh. Again, basta mga dog bites, it's Capnocytophaga. So, you have their mga additional na mga biochemical tests. Which genus of small gram negative Coccobacilli is mainly with animals but may cause endocarditis, bacteremia, and dental infection? So you have their hint oxidase test positive and catalase positive. So the answer is Actinobacillus. This one, a mixture of slender gram-negative rods with rounded ends, which shows pitting of agar, where colonies are located or isolated. Biochemical tests are shown as follows. So oxidase positive, catalase negative, as well no growth on MAC and MAC on carbohydrates negative. So the answer is Eikenella corrodens. So the clue here, class, is pitting of the agar. So mga Eikenella corrodens, muna sila, mag-pit sila. Non-hemolytic smooth gray colonies are covered from infective cat scratch. So you have there a clue, cat scratch infection, but it does not grow on Makonki agar. They are oxidase positive and strongly indole positive. So for cat scratch disease class, it is Pasteurella species, particularly Pasteurella multocida. So kaganina kung si dog bite, it's Capnocytophaga. Kung mga cat scratch, it's Pasteurella species. Which pedia should be used to recover Bordetella pertussis from a nasopharyngeal swab? So this is an example of bordate gango agar. So bordate gango agar is a selective culture medium for Bordetella pertussis isolation, particularly your NPS or nasopharyngeal swab. Which medium is recommended for the recovery of Brucella species from blood and bone marrow infections? Brucella, you have there biphasic Castañeda bottles. So, biphasic Castañeda bottles are the medium of choice for Brucella species because the slant contains enriched medium. So your Brucella, again, is the causative agent of your fever, angelant fever, particularly. So these are intracellular organisms and grows very slowly, usually 4 to 6 weeks after recovery. In addition to CO2, the explanation for this one class, I will send this one to your email via Nika. In addition to CO2 requirements, which test is differentiate Brucella militensis from Brucella abortus? So the answer is thionine and H2S. Because militensis is H2S negative, abortus is H2S positive. For thionine naman, militensis is positive, while abortus is negative. Okay? So for safranin, wala na si safranin. Methylene blue, wala na siya. Iodine, wala na siya. CV, wala na siya. Basic fusin, both of them are positive. Which of the following amino acids are required for the growth of Francisella tularensis? So for this one, the correct answer is cysteine and cystine. Cysteine because it requires cysteine supplements for the growth of your organism. So, cysteine blood agar is the medium of choice for your Plancicella tularensis, di ba? So that is why it requires cysteine. So, for chocolate agar, if ever walay cysteine blood agar available, so chocolate agar will do, but you add cysteine as supplement to that culture medium because the chocolate agar contains X factor, and X factor alone cannot suffice the growth of your Plancicella tularensis. Your Plancicella tularensis, by the way, is the causative agent of your tularemia. Which medium is the best recovery for Legionella pneumophila from a clinical specimen? So this is buffered charcoal yeast agar. So this agar is a non-selective but can be made more selective by adding mga antibiotics class like polymyxin, anisomycin to inhibit the other growths of microorganisms. So for this one, BCYE agar takes 2 to 3 days class before mo grow si Legionella pneumophila. So the agar or the culture must be incorporated with serologic testing as well as direct fluorescence assay para mas ma-confirm ang growth ni organism. Kay slow grower man si Legionella pneumophila. So you need to do direct fluorescence assay as well as serologic testing. Next, Haemophilus influenzae, which requires X and B factors for growth and can be differentiated from H. aegypticus by which two tests? So you have there indole and xylose. Your H. influenzae class as well as H. aegypticus are both glucose, urease, and oxidase positive, while your H. influenzae is only indole positive, while your H. aegypticus is indole negative as well as xylose negative. So mo na siyang indole and xylose siya. Both of them are glucose and urease positive, oxidase and catalase positive, indole positive naman, indole positive si H. influenzae, indole negative si Egypticus. Hemophilus species that require V factor and NOD are easily recovered on which agar? So the answer is chocolate agar. So the V factor and the NOD must be first released from the RBCs before it assimilated by the H. influenzae or H. Haemophilus species in general. So when you make chocolate agar, di ba, imo man na siyang initon. So when chocolate agar is heated class, it will lyse the RBCs. And when malyse si RBCs class, ma-release man na dira ang NAD factor, which is available na for the Haemophilus requirements. This one, identify the biochemical test. This is salitivism testing. So, you streak, ang kaning na streak na naay beta hemolytic is Staphylococcus. Ang kanang mga pinpoint colonies are your Haemophilus influenzae. So, first buhaton, mag-streak og Haemophilus or suspected organism nga Haemophilus, and then you streak the Staphylococcus aureus in between. So if naay growth class, then that is positive for satellites test. Because again, your Staphylococcus, di ba, contains B factor. Majority of H. influenzae infections are caused by which of the capsular serotypes? So this is type B infection. That is why most of the vaccine class towards Haemophilus influenzae are coming from serotype B. Kaya mo ang pinakadaghan nga rate sa infection. Which Haemophilus is generally associated with endocarditis? That is Haemophilus aprophilus. Haemophilus aprophilus class does not require X and B factor. Take note. And they have and they are differentiated from other Haemophilus species by the ability to produce acid from lactose and positive for ALA testing. So again, they are differentiated from other Haemophilus because they are positive by ALA testing and they have the ability to produce acid from lactose. So they are lactose fermenter in short and positive for ALA testing. So wala siya ang test to differentiate Aprophilus from other Haemophilus species. Which Haemophilus species is recovered from genital ulcers and swollen lymph nodes? Hello, madungog na.
Yes, sir, madungog na, sir.
The correct answer is H. ducreae. Or your H. ducreae class is your chancroid na type of infection. So mga soft chancroid type of infection, a soft chancre, that is H. ducreae. Ang hard chancre class, that is Treponema pallidum. Which characteristics of H. influenza strains are resistant to ampicillin? So the answer is beta-lactamase enzyme. Remember your ESBL? So muna siya, production of beta-lactamase enzyme. So if ever the organism is resistant to ampicillin or mga penicillin derivatives, automatic class ka na sila nag-produce of beta-lactamase enzyme. So dili mo pwede gamitan og mga beta-lactam drugs. The delta ILA testing or for porphyrins is confirmatory test procedure for which test used for the identification of Haemophilus species, that is your X factor. Ba? So, your X factor requirement for the growth is of Haemophilus species is a must. Yun na siya. So, for ALA testing, that is for X factor nga enzyme, X factor nga requirements. Colonies that are said to resemble droplets of mercury are associated with what disease or infection? That is whooping cough. So, causative agent for whooping cough, this is Bordetella pertussis. So, colonies for Bordetella pertussis are described to be droplets of mercury. Which of the following disease is most likely to be acquired from hot tub or whirlpool? So you think of organisms na pwede makuha sa mga water sources. So the correct answer is Pseudomonas dermatitis. Because Q fever, makuha siya from inhalation or direct contact. Erysipelas, di ba, skin infection, mga causative agent kay Staphylococcus and Streptococcus, Acetobacter cellulitis kay dili, Pseudomonas dermatitis possible for water sources. Because again, your Pseudomonas is the significant organism present sa mga contaminated waters. Causative agent of the form of conjunctivitis known as pink eye. So that is Haemophilus aegypticus. So pink eye conjunctivitis, causative agent Haemophilus aegypticus. I want you to study class sa notes ninyo how to differentiate the species of Haemophilus because that might come out during comprehensive exam. Okay? So study to naman to table dito sa modules on how to differentiate Haemophilus because there might be problems that will come out during your comprehensive exam. So SRUs can cause conjunctivitis as well, Chlamydia trachomatis and Neisseria gonorrhoeae, but pink eye conjunctivitis primarily is caused by Haemophilus aegypticus. In suspected cases of brucellosis, what is the most sensitive specimen submit for culture? So the correct answer is bone marrow. Manisya sa inyong module po. The optimal specimen for recovery of Legionella pneumophilia. Since Legionella pneumophilia affects lungs class, so the clinical specimen of choice is bronchial washing. So from the name itself, pneumophilia, so it causes lung diseases. Foodborne outbreaks of brucellosis are most commonly associated with imported cheese, mga milk products for brucellosis. So raw shellfish is for Vibrio, contaminated potato salad is for mga Campylobacter as well as Staphylococcus. Improperly home-cooked burger is commonly for E. coli. Mycobacteria have a large amount of components in their cell wall that other bacteria lacks. That component is your lipids. So particularly your mycolic acid. When clinical specimens are processed for the recovery of Mycobacterium tuberculosis, the general recommended method for digestion and decontamination of sample is the use of NaOH and NaOH. So this is the common digestant used for sputum sample class if you do TB culture. The etiologic agent of Hansen's disease, that is M. leprae. Hansen's disease is also known as your leprosy. Diba? You have two common types of leprosy. You have your tuberculoid type as well as lepromatous type. There is also one borderline type, but borderline is in between your lepromatous type as well as your tuberculous type of leprosy. So, in order to differentiate the two, di ba, lepromatous type is more positive sa skin test, sa lepromin skin test, while negative naman si tuberculous type. Tama ba ko? Okay. Yes. Oh, tama. So, tuberculoid type, positive siya for, negative siya for skin test, while a tuberculoid type is positive siya for skin test class, sorry, while negative siya for lepromatous type. Skin test, lepromin test. Or, in some textbooks, they call it as Fernandez or Mitsuda testing. But commonly, we call it as lepromin testing. The finding of 4 to 6 acid bacilli per field in toxin smear expectorated sputum should be reported as 3+. Basta makakita na kag mga 4 to 6 class, that is 3+ already. Walay 4+ so far sa CDC guidelines o sa DOH standards na Dutch treatment. There is 1+ if 1 to 9 per 10 fields, if per 100 fields, 2+ if 1 to 9 per 10 fields, 3+ pag more than na siya, 1 to 9 per fields, wala ni ang 4+. There is also one, katong plus N, if ever you see acid fast bacilli per field. So, mag-plus N ra ka. So, this, according to DOH standards class, positive nga 2 samples, positive class is considered nga si patient is na ITB. 2 out of 3 sputum samples. But there is a newer guidelines na 1 out of 2 na lang. Kaya sa una, 3 yun nakabukang samples na dapat i-collect for sputum testing for TB. But karon na ay bagong guidelines nga pwede ra duha. So out of sa duha, kung mag-positive kag isa, then i-considered ka as positive for TB. And that should be also accompanied by the radiologic findings class. Of course, the gold standard for TB diagnosis is always TB culture. Although TB culture is kanang will take time because your TB organism is a slow grower organism, but still the gold standard is TB culture. Na ginagamit karon, we call it as gene expert. We detect now the gene presence on the sputum, PCR siya nga method. So, mo na siya ang newer nga ginagamit sa laboratory, gene expert. So, kung positive ka sa gene expert also, gene expert can also detect whether that TB is multi-drug resistant TB ba siya or dili, para mas mapadali ang treatment. Which of the following Mycobacterium species is associated with livestock and causes zoonosis? So that is your M. bovis, particularly sa mga tao. Which of the following drug is not considered as primary antimycobacterial treatment? So, the correct answer is kanamycin because kanamycin class is a secondary line treatment ra gyud na siya. Ang primary treatment is your isoniazid, rifampicin, pyrazinamide, and ethambutol. Kana silang upat. So, ang mga secondary line treatment is the primary treatment plus another antibiotics. In the decontamination and digestion procedure for the isolation of Mycobacterium sample, what is the role of NaLC? As I said, kaganina, digestant siya. So digestant, so it liquefies mucus. So it's not bactericidal, it's not growth stimulant, it does not also neutralize pH. So it just liquefies mucus. Just digest the mucus para easy siya ma-culture. Kaya diba kung sputum sample class, kay grabe man na siya ka-sticky. Which of the following mycobacterium appears as buff-colored colonies after exposure to light and is niacin sensitive? So the correct answer is Mycobacterium tuberculosis. So Mycobacterium tuberculosis is niacin positive na TB. In the picture, this is an algae slant showing you the growth of TB, Mycobacterium tuberculosis. If ever class, the growth is non-Mycobacterium tuberculosis complex or your NTM, ang kaning culture medium ng algae slant class kay sana siya, ma-liquefy siya. Dili siya motubo kung dili siya Mycobacterium tuberculosis. Next, the etiologic agent of swimming pool granuloma, that is Mycobacterium marinum. So from the name itself, swimming pool, so water-associated mycobacterium. So that's Mycobacterium marinum. Which of the following is a fluorescent stain for mycobacteria? So fluorescent stain for mycobacterium, that is auramine rhodamine staining. Alkofluor white stain is not commonly used for mycobacterium. This is commonly used for mga yeast infection. Fluorescent isocyanate stain is commonly used for mga biopsy infection. Ziehl-Neelsen is definitely not a fluorescent staining because this is a differential stain. One of the method of your acid fast stain. Which of the following is not true of M. leprae? So M. leprae is causative agent of Hansen's disease or your leprosy. Yes, it's difficult to grow in vitro. That is why it requires animal culture. So patubuon siya sa katong mga foot pads sa armadillo or sa mga rodents. It is easily transmitted from person to person. It is not easily transmitted. Mo na siyang dili siya true kay M. leprae. It usually grow in peripheral limbs of infected patient, particularly sa mga lepromatous type of leprosy. So, these are not easily transmitted class, unlike sa myth before nga mo nang mahadlok sa una sa mga tao for leprosy kay dali ra siya matransmit. But we found out that the infection is not easily transmitted from person to person. Before, if the patient is positive for leprosy class, gina-isolate gyud na siya, same with TB. But now, TB patients as well as leprosy patients, wala na sila i-isolate because there are antibiotic treatment available. Which is the most appropriate non-selective medium for recovery of mycobacteria from a heavily contaminated specimen? So that is Pegranani agar. The definition of this agar class is found sa inyong module. Nasa module 27 o 28. All of the following mycobacteria are associated with skin infection except your Mycobacterium kansasai. Okay? So, Mycobacterium kansasai, definitely dili na siya for skin infection. But, usually sa, ano na siya, okay. So, your Mycobacterium kansasai class is one of the causes sa imuhang pulmonary disease and the same characteristic with classical tuberculosis, while your M. marinum, Haemophilum, and ulcerans are causative agent of skin diseases. Which of the following mycobacterium produce pigmented colonies in dark or your scotochromogen? So that is M. solgai. So your M. solgai is a pathogenic scotochromogen together with your scrolactisium, your Sanofi, na sila, mga scotochromogen na sila. But your kansasay, kansasay, di ba, is photochromogen after exposure of light, while your M. tuberculosis does not produce pigmentation in the dark or after exposure of light. So, M. sodai is the closest answer for this question. Which of the following Mycobacterium species is differentiated by a rapid hydrolysis of twin 80? So, the answer is M. kansasai. So, the hydrolysis of twin 80 class is usually positive when testing clinically insignificant Mycobacterium species. So, your M. kansasai hydrolyzed 2080 rapidly more than the other Mycobacterium species. So, a positive reaction usually change in color from yellow to pink. Urease test is needed to differentiate Mycobacterium scrolapicium from which of the following mycobacteria? So that is Mycobacterium gordonii. How long should M. tuberculosis culture should be kept up by the laboratory after identification of antibiotic susceptibility testing had been performed? So the correct answer, class, is 6 months to 12 months or 1 year. Di na siya nimo i-keep ang M. tuberculosis culture. This is if ever, class, the organism or the doctor rather requires additional susceptibility testing. Kaya naman yung uban, class, nga MTB, ini first perform nimo sa iyaha, mag ano pa na siya, mag susceptible for that particular antibiotic, but katugayan mag-resistant na siya. And if ever put, there are additional antibiotics like for secondary line defense, secondary line treatment for tuberculosis, kaganaan si Dr. Ipates. So you need to keep that one. The results for TB culture class is approximately 4 weeks. Yun na siya. So, sometimes maabot siya 6 weeks. So, 4 to 6 weeks na sila. If the same with your fungal culture, because your fungal culture is roughly 4 weeks man po na sila. Because they are slow grower. Which of the Mycobacterium species would most likely grow on Maconchi agar? So that is Mycobacterium cheloni fortuitum complex. This is found sa inyong notes. Nako, siya gikuha. Which of the following medium is the choice of selective recovery for gram-negative anaerobes? For gram-negative anaerobes, this is kanamycin, vancomycin, agar. So PAIA, CCFA, thiobroth are not commonly used, not specifically used for anaerobic organism. But for anaerobic specific ganisia, that's kiwi agar or kanamycin, vancomycin agar. Anaerobic bacteria are routinely isolated from all following types of infection except your urinary tract infection. So, abscess, lung abscess, brain abscess, and dental infection, you can isolate anaerobic bacteria. But for urinary tract infections, class, definitely, dili gid ka maka-isolate og anaerobic bacteria ana niya. Because most likely, urine man imong gamiton. So, urine, dili na siya makakuha og anaerobic bacteria. Unless, if you use swabs, like genital swabs. A gram-positive spore-forming bacillus growing on a shaped blood agar plate anaerobically produce double zone of beta hemolysis and positive for lecithinase test. So what is the possible presumptive ID? So the answer is Clostridium perfringens. So the keyword here, class, is double zone of beta hemolysis and positive for lecithinase test. So, among all the gram-positive spore-forming bacillus, your Clostridium perfringens only shows the double zone beta hemolysis. Egg yolk agar can detect which enzyme produced by Clostridium species. So obviously that's lecithinase enzyme. So egg yolk agar is specific for Clostridium species. Which mechanism is responsible for botulism in infants caused by Clostridium botulinum? If ever, class, this is kind of tricky because if ever the questions refers to infants, the answer is spores in food or fluid or liquid rather. But if the question is both infants and adults class, the answer is ingestion of preformed toxin. Again, the mechanism, if infants ang question caused by Clostridium botulinum, the answer is spores found in food or liquid. But if the question refers to adults and infants, the answer is preformed toxin. For infants, for Clostridium botulinum, this is common sa mga materials like mga honey, sila. So, common na sila. Actually, Clostridium botulinum is common in the US because they like mga ready to eat na mga products for their infants. Which test is performed in order to confirm infections with Clostridium botulinum? So the answer is toxin neutralization testing. Spore forming test is not specific. Lipase test, wala na siya appeal. Gelatin hydrolysis test is not specific as well. So in order to detect, in order to confirm rather the presence of Clostridium botulinum, you need to do toxin neutralization testing. Which Clostridium species causes pseudomembranous colitis or antibiotic-associated gastroenteritis? That is Clostridium difficile. So this is Clostridium difficile is the correct answer. Identification of Clostridium tetani is based upon the closest answer for this one class is clinical findings by identifying spastic muscle contraction because your C tetani again, if you remember the first week na to na mga discussion, your C tetani produced neurotoxin called tetanospasmin. So it causes mga lockjaw infection or Rhesus sardonicus if you read your module. So that is the identification that the patient is having tetanus infection. Gram stain of the wound site, dili siya na naka-specific because there are some Clostridium class that may appear spore forming as well as terminal spores po siya, the same with tetany. Anaerobic culture of the wound site is not specific as well as blood culture result. So clinical findings is the best choice for this type of question. Obligate anaerobic gram-negative bacilli that do not form spores that grows well in 20% bile are resistant to penicillin 2 unit disc are most likely Bacteroides. So mga obligate anaerobic class as well as they are resistant to penicillin, those are Bacteroides species. Which Bacteroides species is noted for pitting of the agar? So the answer is Uroliticus. So kaganina, di ba, kita ganito sa non-Enterobacteriaceae family ang nagpit sa agar, that is Echinella corrodens. So another organisms that pits sa agar is your Bacteroides species, particularly your Bacteroides uroliticus. So it is resistant to penicillin 2 unit disc. So if you measure the the zone of inhibition ana, and compared to the chart, that is resistant. Which gram-negative bacilli produce black pigment and brick fluorescence when exposed to UV light source? That is Porphyropomonas and Prevotella species. Among those, the choices class, si Porphyromonas o Prevotella species ra po dira ang naay pigment nga mo produce. Si Fusobacterium, Actinomyces, Bacteroides, and Fusobacterium, wala na sila pigment. Which of the following genera of anaerobic cocci that stain gram-positive except Vionella species? Peptococcus, Peptostreptococcus are both gram-positive. Streptococcus should not be the answer because the question refers to anaerobic organism. So Streptococcus are facultative anaerobic. So Vionella species is the correct answer because Vionella species is gram-negative cocci, if you remember the Gram's rule. Which Clostridium species is mostly recovered from wound infection with gas gangrene? So Clostridium species that is the causative agent of gas gangrene, that is Clostridium perfringens. Again, Clostridium perfringens, in order to identify this one, you need to see the double zone of beta hemolysis. Antimicrobial susceptibility testing for anaerobes is done by which of the following tests? So you have their pictures. The pictures already give you the clue that this is microtube dilution. Brought this illusion and brought this agar diffusion class should not be used because you will be exposing the microorganism to the oxygen. So dili na siya pwede. Ang microtube dilution ra ang possible nga pinaka-close. So for microtube dilution, of course, you will check the MIC and the MBC. MIC of the So pinaka minimal inhibitory concentration, ang pinaka wala na dira na turbidity sa mga tubes. The characteristic colony morphology of Actinomyces israeli on solid agar resembles molar tooth is the correct answer. Medusa head, this is for Bacillus anthracis. Fried egg, lahi po ni siya. And ground glass appearance, this is for Bacillus cereus. One. Which of the following Clostridia has terminal spores that causes cell to swell? So terminal spores, you have there Clostridium tetani. Clostridium botulinum is different. Lahi yung kuan kay spores. So for Clostridium botulinum class, yung spores is different. Central usually. For Clostridium difficile, sometimes central, sometimes subterminal. For Clostridium perfringens, definitely it's subterminal. Ang pinaka-terminal ra gyud nga spores kay si Clostridium tetani. Mao nang siyang name pod kay tetani. A tube of the semi-solid medium that contains reassurance appears pink. What does it mean? It means there is presence of oxygen. So if the reassurance indicator turns color pink, meaning na exposed na siya to oxygen. So reassurance is an indicator for oxygen. Identify Fusobacterium species considered the most frequent isolate recovered from clinical infection. So there is only one, I think, one known species for Fusobacterium class, and that is Fusobacterium nucleatum, that causes common pathogenic infections to human. Which of the following is the most potent bacterial exotoxin known? The answer is botulinum toxin. So these are the most potent. Botulinum toxin mo po na siyang ginagamit, di ba, for Botox, sa mga surgery, mga cosmetics. So these are the potent exotoxin. Erythrogenic toxin, This is bacterial exotoxin as well, but this is not potent. Clostridium difficile toxin B, it's an exotoxin produced by C. diff, but it's not that potent compared to bacterial exotoxin. Which of the following tests is most appropriate for the ID of C. difficile? C. difficile class, you need to perform cytotoxin testing because you need to identify whether it's toxin B, toxin A, or toxin B ba na siya or both. So, sensitivity test, susceptibility to sensitivity test is not being done. Nagler test is not being done. Fluorescence test is also not being done by C. diff. So cytotoxin testing. That is why in the laboratory class, if the patient is suspected for C. diff class, laboratory performs serologic AIA testing or ELISA testing to determine whether the toxin is caused by A or B. Which of the following test is most appropriate for the presented identification of Clostridium perfringens? That is forced reverse Camp test. Atong double zone o beta hemolysis. Reverse Camp test also is seen sa Listeria. Alright. Early review. Ang Listeria species. Which of the following is an important virulence factor of Bacteroides fragilis? So Bacteroides fragilis is a capsulated organism. So definitely the virulence factor is polysaccharide capsule. So if the organism contain capsule, so the main function is antiphagocytic. Aspiration of vomitus can lead to pneumonia. Which of the following is not be likely the causative agent of aspiration pneumonia? The answer is Mobilingus species. Bacteroides species, Porphyromonas, and Prevotella species can cause aspiration pneumonia, while Mobilingus species class is never because Mobilingus species is usually isolated sa mga genitourinary tract. So, mga genitourinary tract infection na siya. Your Bacteroides, Porphyromonas, and Prevotella species are aspiration pneumonia agents. To ensure anaerobic conditions had been in anaerobic jar or chambers, an oxygen-sensitive indicator is employed such as, the correct answer is methylene blue. So, if the color will change into blue, yeah, then that is exposed to oxygen. White, then wala. Which anaerobic bacterium is part of the normal vaginal flora that helps resist the onset of bacterial vaginosis? So, I think you know this, that is Lactobacillus species. So, Lactobacillus species is a normal flora of your vaginal area or genitalia. Lactobacillus is species class ha, is lahi po tong sa Lactobacillus species nga naa sa Yakult. Chlamydia trachomatis causes which of the following infection? So your Chlamydia trachomatis causes inclusion conjunctivitis. So kaganina si pink eye conjunctivitis is Haemophilus ducreae. So si Chlamydia trachomatis is inclusion conjunctivitis. Which of the following microorganisms cannot be cultivated in artificial cell-free? So that is Chlamydia trachomatis. Because your Chlamydia trachomatis should be cultured using katong mga HeLa cells, katong mga pa to na mga basta dapat sa cell line siya i-culture class, dili siya motubo on an ordinary culture medium. The etiologic agent of primary atypical pneumonia, so that is your Mycoplasma pneumoniae. Your Chlamydia psittaci, definitely not associated with atypical pneumonia. Chlamydia pneumoniae, dili po na siya. And Streptococcus pneumoniae is definitely not an atypical type of pneumonia. Chlamydia psittaci in human most commonly result after exposure of avians. So, Makuha siya after exposure sa mga birds class, cetacean infection. Which of the following is not true of Coxella burnetii? Coxella burnetii is, yes, it is an obligate intracellular parasite. It is transmitted from animals to human via inhalation, and it is the etiologic agent of Q fever. But rashes does not appear on the extremities for Coxella burnetii. Lahi iyahang signs and symptoms. Coxella burnetii class is also a spore-forming gram-negative rods. So, dili na siya pamatay on an ordinary disinfectant. It requires autoclaving in order to kill Coxella burnetii. Which of the following is not true about Chlamydia pneumoniae? So, Chlamydia pneumoniae is a common agent of lower respiratory tract. That is true. Then these are treated using tetracycline and erythromycin. And these are associated with coronary heart disease. So humans become infected from animal reservoir. That is not true about Chlamydia pneumoniae. Colonies of the fried egg appearance. Oh, this one, fried egg class. So fried egg is common for Mycoplasma species. So again, fried egg, Mycoplasma species, Medusa head, Bacillus anthracis, and there is another one katong isa ka gram positive but check the other biochemical test. And sa patong isa, ground glass appearance, si Bacillus cereus, droplets of colonies, katong mercury. So, memorize those characteristics. Q fever is acquired by, we already mentioned this one, Q fever is caused by Coxella burnetii and it is acquired by inhalation of infectious material. The causative agent of Rocky-Mountain spotted fever is Rickettsia rickettsii. So these are the agents. These are ticks class. These are not common in the Philippines, but this is common in European nations. Rickettsia prowazekii is associated with squirrels, particularly the salvatic form typhus. So, the causative agent of endemic or murine typhus, that is Rickettsia typhi. Although class D, kaning sa mga Rickettsia, mga chlamydia, o mga mycoplasma, gamay rapod kaay nga percentage among gawas ani sa board exam because these are not common in the Philippines. The screening test for ID of Mycoplasma pneumoniae includes lysis of the blood cells. So this is the screening test for Mycoplasma examinations or identification. Etiologic agent of syphilis. So you have your T. pallidum, marong. The routine culture for T. pallidum involves serologic testing. Since T. pallidum class requires, these are intracellular type of organism, so culturing is not choice. Culturing is not a choice. Then acid-fast staining also is not a choice. Pwede naman na siya acid-fast bacteria. Gram staining is definitely not a choice because gram stain is not for gram stain for Treponema pallidum, kasi man na siya makita, di ba? It requires special staining. So that is why serologic testing is definitely the routine laboratory test for Treponema pallidum. Spirochetes, often detected in hematology laboratory, even before physicians suspect the infections are, the correct answer is Borrelia species. Because Borrelia class can be identified sa blood smear, automatic. Biskan right stain pa lang na siya ang gamiton class for, di ba right stain ang commonly used for staining peripheral blood smear. If you still remember your PMLS2, so Using right stain alone can detect Borrelia species or Borrelia infection. Treponema, of course, dili siya makita. Campylobacter, dili po na siya makita, as well as Leptospira. Etiologic agent of your Lyme disease, that is your Borrelia burgdorferi. So Borrelia burgdorferi or your Lyme disease is transmitted by ticks, di ba? Exodus species. So the diagnostic method for identification of Lyme disease is always serology testing. So culture, although is the diagnostic for Lyme disease, but dugay man siya class. So serology is the diagnostic test being performed. So Magnus chloride test is used to ID which microorganism. This is Mycoplasma. This is Ureaplasma ehrlichicum. Kaning mga dark colored na circle, these are ureaplasma. Ang kaning marag fried egg class, these are your mycoplasma. Serous congenital infection are associated with Treponema pallidum, subspecies pallidum. So, mga congenital infections class, that is Treponema pallidum. I want you to familiarize also the table on your module about the different subspecies of Treponema pallidum. Kung saan na mga sakit ang naa nila. Diba naman ito'y pertinue, causative agent of the use, katuminan na. So, familiarize those one. Borrelia recurrentis is transmitted by, sama ni siya, this is your lice, pedunculus. So, Borrelia recurrentis is transmitted by this one, human louse. So, which of the following is true of BDRL test? So, true. So, which of the following is not true, by the way, of the BDRL testing? So, this is inactivated T pallidum serve as the antigen. So, both of them cause false positive. It also increased the titer will decline if the patient is adequately treated. And the test is usually positive in secondary syphilis. So, inactivated T pallidum serve as antigen. That is not true for BDRL testing. So, we'll discuss BDRL and RPR test when you go for serology next month. Basta BDRL and RPR class are non-treponemal tests for syphilis. The eggshell filaments of spirochetes class resembles which structure? This is flagella, because your eggshell filaments serves as the organ of locomotion for your spirochetes. Wala man na sila flagella, but rather they contain eggshell filaments. Those eggshell filaments are found sa ilahang cytoplasmic membranes. Detection of antibody against cardiolipin is useful in the diagnosis for which bacterium? Again, as I said, this is for Treponema pallidum. So Treponema pallidum, non-treponemal test, you have your RPR and your BDRL. There are non-treponemal assays and there are also treponemal assays. So, lain-lain na siya class. Ang pinaka-specific nila is your FTA-ABS. Kani. Your FTA-ABS is the most specific treponemal test for Treponema pallidum or for syphilis. Okay. Questions, clarifications. I will send, by the way, the answer key of the modules sa group mayor or through Nika, and Nika will share it sa group mayor. Questions, clarifications? Sir, what time ang exam in the afternoon? Exam sa afternoon, 2:30. 2 o'clock to 3:30. You can ask extension sa sa inyong teacher kung naamoy mga circumstances. But for compre class, I think I will allot 2 hours if ever kung taas yun kayo ang exam. Questions?